say 1, 2, 3 now and start off. 1, 2, 3. Good evening and good morning, everyone. This is a special podcast with Professor Josh Gans, who is joining us live from Toronto right now, from the University of Toronto at the Rotman School of Management. Today's podcast is going to focus on his new book, Economics in the Age of COVID-19. We all know Josh as a prolific scholar, but it was fascinating to see that his book is also out on this issue. Welcome, Josh, to our podcast.
Hi, great to be here.
Thank you. So, Josh, I am interested in issues around applied microeconomics in healthcare markets, and what caught my attention was this book seems to be touching several issues on the supply side, on the demand side, as well as on public policy aspects of broader issues beyond healthcare, but also potentially within healthcare. To start off the conversation, could you just motivate what got you into this book? What made you write this book in the age of COVID-19, especially for us as business school professors? If you could just tell us something about the backstory behind this book. It's so fascinating.
Yeah. I wish I could say that I heard reports in December of a strange new virus, and I started writing immediately. But that wasn't the case. In fact, it was really only once I was stuck at home myself in mid-March that I, wondering what to do, that I thought, maybe I'll just write a book, because there's so much going on, and it might need some explaining to a non-economic audience.
Mm-hmm.
And if I set myself that task, it'll also help me as well try to understand what's going on. And so that's really all it was. It was just a thought that I had. I didn't feel that I felt that this would be. I guess some people try to learn how to bake, and some people try to learn various things in a lockdown, and this was my one, and the hope was that it would come up all right, and it would be useful to people.
Interesting. So I was actually scrolling through the book and looking at the chapters. You have a fascinatingly titled Chapter 1, which talks about health before wealth, and turns out that's the debate we were having, and we are still having, whether these lockdowns across countries were really necessary. Non-pharmaceutical interventions, people are saying, should we compare to the 1918 Spanish flu influenza, or should we compare to the 57-58 Asian influenza? My question to you, given this debate that exists in the literature and how the narratives have shifted globally from lives versus livelihoods to lives versus lives to living with the virus, what's your take on health before wealth? What do you document there? How should we, as business school students and scholars, look at the first chapter in setting up the context for this book? And perhaps you can also point to some heterogeneities here in developed markets as well as developing economies.
Yeah, so I think health versus wealth is a very tricky issue. It is very clear that if you want to absolutely knock out this virus once it's got started, if that's your goal, you have to really, really lock down your economy, which of course involves economic sacrifice. If people are at home, they can't be out producing, so that's going to be a problem. So, there is that. If the policy choices are between doing nothing and eradicating or really crushing the virus, that's a direct trade-off, at least in the short run, between health and wealth. However, actually, now that we've had a few months to sort of see what has happened, and we have some countries that were able to suppress and pretty much kill off the virus.
Right.
You have South Korea and Taiwan and Mongolia, and then you have, and they did it all without lockdowns. There was economic pain because people were naturally socially distancing, but there was no widespread lockdown. And then you have countries like Australia and New Zealand who were able to suppress the virus with lockdowns as well. And so when you look at those countries, they are all able to open up. Their economies are going to start coming back, and they don't have much of a virus. So in other words, it's not that there was this, that doesn't look like a trade-off anymore. That looks like a
Right.
better outcome
Yeah.
for both health and wealth. With the rest of us, we are facing this on a daily basis. Everybody trying to work out, how much should we lock down? How much should we open up? And there's this toing and froing going on between health and wealth. I think the issue really that when we look back on this is what you needed was a plan. There was no trade-off between health and wealth if you had a plan. If you don't have a plan, you have to confront that every day, and you're in a bad outcome regardless. So I think that's really where we are on that. In other words, I think what we learned from this virus was it was worthwhile taking action and taking action early and getting rid of it. And this might be the thing for all viruses. But if once you didn't do that, you're in for this long haul of which you could call it a trade-off between health and wealth, but basically you've got reduction in wealth and a reduction in health as well at the end of it. And so that is painful to have watched. And I must admit, when I started writing this book, I did not understand how fully those trade-offs were there. I think we were, the translation coming out of what our options were, what the end game was just too difficult. It was too blurry. But now we're sort of seeing what some countries can do. I would be in favor actually of saying, okay, we should just lock down again and get this done and get it fully suppressed. And it's going to be terrible economic pain, but it's better than stretching this out over 2 or 3 years.
Yeah. So India just actually eased its lockdown today, and I was looking at the roads. People are almost in a mode of, oh, Corona is gone. It's like back to like old days. So I'm quite scared.
But it only needs a seed. This is how bad it is. There's it's not quite this, but there's a sense in which zero means zero. Is you've got to wipe it out. If it's roaming around there, it'll eventually hitch onto that exponential growth and come back. Now, one way you can get away with not having all the way to zero is if you are, when your virus prevalence is low, you engage in testing and tracing, and so whenever the virus appears, you quickly hit it. And that's what that's effectively what South Korea did, and that works as well. So the problem is that you have to be able to take action whenever this virus emerges. And so it's not just a reopening and hoping for the best. In fact, the likelihood is not going to be the best. You actually have to have an active policy.
Yeah, I mean, this is a little bit of a segue, but just to add to your point on being strict about subsequent waves, if required, for societies, there could be secondary bacterial infections. And with contexts like India, where there is antimicrobial resistance and antibiotics no longer working enough, that would be even more dangerous of an issue to face. But I hear you completely. So
we just don't know. We just don't know. I mean, it's just like, the evidence. There's good, solid evidence to this was a war that you wanted to win and win quickly.
Exactly.
What puzzles me is that so many countries, appear to have given up and not really trying hard, and that just does not look like a good outcome. I say this: Canada has not been doing particularly well in this either.
I mean, which brings to my chapter to your chapter 3, which is titled "A War Footing." Right? What do you mean by a war footing? I've heard like journalistic discussions of having a Marshall Plan to fight COVID-19. So, I mean, if you could just describe
that's a recovery plan, Marshall Plan. Marshall Plan is a recovery plan, but the issue was at the time that I was writing that, we were very worried that hospital capacity might run out, that lockdowns wouldn't work, hospital capacity might run out. It turns out actually, most countries were able to expand that capacity, and it's not been that terrible a situation. So from that point of view, it's correct. But there's this other point of view, as you know, I'm no history of warfare, and of course, you know, the analogy can only be stretched so far. But having your entire country have resolve in terms
Mm-hmm.
of what they're going to do in terms of winning the war, you know, a country with resolve and also with a superior military.
Mm-hmm.
The only time countries with superior military lose is when they don't have resolve. And there's a similar sense in which you have that for the virus as well, except we do have already the superior military. So what you'd have to do is have resolve. You
Mm-hmm.
have to basically say, you know, I'm going to have situations where there's a low amount of this virus, but I'm still going to wait it out,
Mm-hmm.
even though it looks like everything is fine, just to make sure that we've done the job. And that's kind of like a war footing as well.
Mm-hmm. Mm-hmm. Let me switch focus to the supply side. In our last podcast with your colleagues Anita and Will, there was an interesting, I would say, issue that we discussed about multi-firm coordination that is surprisingly happening in the context of getting ventilators out and masks out and testing kits out, etc. Will was saying that there is some immensely heartening social orientation that firms are showing in getting innovation out. And you have a final chapter of the book, which is on innovation in this COVID-19 world. What would be your
Yeah.
recommendations, building on those insights in that chapter, to firms and policymakers, both in the rich world and the poor world? What are you observing? What is not going right? And what would you rather
Right.
have in a normative sense?
So I think, you know, so if the way you have to sort of think about this is to sort of work backwards
Mm-hmm.
from the future. So a vaccine becomes available.
Mm-hmm.
Then it has to be manufactured. And that's
Mm-hmm.
no mean feat, because we want to distribute it to billions of people
Mm-hmm.
in order to get the world economy. You want to distribute it. How are we going to do that? How would that be done? It's not going to be likely done on the basis of a market forces. It's going to be done on people setting up manufacturing facilities where they're best set to be done, and then distributing it according to some government-run distribution mechanism. Okay, take that. Question is, now the vaccine appears. Where does it appear?
Right.
Who gets the vaccine? Now, the good news, I think, is that vaccines are very easy to imitate and stuff. So if the vaccine appears somewhere, it's basically appearing everywhere.
Mm-hmm. Mm-hmm.
So the hard bit is that each different vaccine candidate has a different manufacturing requirement. They've got very different things that they do. And so they all need their own purposeful manufacturing requirement.
Mm-hmm.
So it's really a case where we don't care where the vaccine arrives. If it arrives, it's good for the world, and that's great. But we do care about how we are going to, of knowing what that is and being able to manufacture on that basis. So that's the fundamental problem being faced. Now, Bill Gates has come up with a solution. He's basically come up and said, okay, well, I'm not going to wait to see which vaccine candidate is the right one. I'm going to build 7 plants
Mm-hmm.
capable of producing these things and throw 6 of them away.
Mm-hmm.
And the reason you do that is because the economic pain is so high that you want to, you know, you don't want to do the normally sensible thing and just distribute this. You want to be able to go very quickly, which means building in a lot of redundancy. And so that's the locus of where innovation is sort of has to have happen in that regard. In terms of everybody rushing to produce a vaccine or to come up with a vaccine candidate, there's ample evidence now that is set at a max. There's nobody sitting around saying, well, I don't know if I should produce a vaccine if they've got a good idea for. They're trying to do it. And if they're in a particular country, that country is normally helping them along. So in that sense, we're getting cooperation. But we have no real clear plan of how to allocate the manufacturing capability, because it's highly likely that some countries will have that earlier than others,
Mm.
and you want to work out what to do about that. And I think there's a good set of countries that are cooperating on this. Canada is part of a coalition for this. The United States and Russia and India and China are not,
Okay.
which is of a concern. So what's going to happen circa 2021 is going to be a big mess.
Is
So
Brazil a part of? Is Brazil a part of that bloc which is not part of this coalition as well? For reasons we can only guess.
I'm not sure. I'm not sure of all the details of who is part of it. And I think part of it is also that, well, I mean, the world is not as cooperative a place as it was 5 years ago, and that's a real problem. I think we have in a number of countries some people have got far more insular, far more nationalistic in terms of national priorities, and that it does impede cooperation at a time like this. I don't know if that's going to end up being a problem or not a problem, because as I said, we haven't got a plan yet. And so we'll have to see, but it's something that does worry me. And I think it comes back to this notion of how are we going to innovate and how are we going to coordinate our innovation, because we really can't afford the usual stuff with innovation where we sort of take our time and work it out and try this path, that path. We really have to get on with it.
And I'm tempted here to actually take you back to your old research. So papers that you have written in early 2000s on product markets for ideas and the role of technology entrepreneurs still are very highly cited by junior scholars like us. What do you anticipate the effects of all of this lack of coordination and the frictions that are there on the supply side on startups and, let's say, the Gale of creative destruction, as you enigmatically call one of your Rand Journal of Economics articles? Any thought experimenting there?
Oh no, we're thinking about that all the time. So I have behind me the Creative Destruction Lab, which is a lab that started in Toronto but now is in 7 places around the world, and we formed a stream to incubate and sort of advise startups who were dealing with the COVID recovery, we call it, because they call it CDL recovery. But the thesis of that is like, there's a lot of things that need to be done. You have to sort of do all this public health innovation or health innovation. And that's, vaccines, treatments, things like that, lots of stuff. There's a whole lot of stuff that is around to sort of make it more comfortable for people to work from home and things like that. The Zoom meeting we have now that's allowing this is one of those. And there are a few others sort of creeping up around that. But the way we sort of said, what can startups do? What can startups do? Because, it's very hard to be, you can be a startup and produce a vaccine and do well, then you have to license it. But, startups are pursuing more radical things. And right at the moment, it's trying to find things that are going to work and work quickly. So we don't have that same risk equation. For things like work from home and stuff like that, well, there are good markets for this. That's why we have Zoom and things like that.
Right.
But the critical thing about this pandemic is that it's fundamentally an information problem.
Yes.
That is that we don't know, if we know who is infected, we can isolate them and get rid of this pandemic quickly. But the problem is, of course, we do not know that. And so there's a lot of talk about testing, and the problem with testing at the moment, it's too high. But it's not just testing, it's just knowing what the parameters of this disease are in the populations we have, or to be able to monitor an outbreak. And all sorts of aspects about that to work out whether people are complying with social distancing, whether they're wearing masks when they should be wearing masks, and all this sort of stuff. So what we've done is we've started to have startups apply to us, and if there's anyone listening to this, they should think about that too, who can solve that information problem, that play a role in that stack, that technology stack that will do so. Because this is a thing that startups can do. It's a fairly novel problem. The chances are that it will require a lot of digital technology, and therefore it'll be able to be implemented by startups at scale much more easily than other things. And so that's where the push is. So startups dealing with the COVID issue, I think the big opportunity is to be able to solve the information problems, because it's not just selling to governments. Because as we open up the economy, all of the public health stuff, the policy that governments have been currently responsible for, right, become the responsibility of anyone who has a physical space and has people coming into it. Those public health problems now become your private health problems. You have to protect your employees, your customers, your contractors, your suppliers, everybody who interacts in those spaces. And so it doesn't matter what the government says regarding how best to do that. There are different businesses for which you need to keep people safe, and you'll have, therefore, great demand for solutions that allow you good management. And good management here means understanding what the risks are in your workplace. And that means measurement and testing and other things like that. There's sort of two things you can do. You can test and you can measure stuff, or you can offer what we call always on solutions, where you sort of put up barriers and things like that and whatever that's just there. If there's an outbreak, it stops it from spreading too much. So that is all going to, over the next 2 years, that businesses are going to need that. And the sooner they get it, the sooner that they can open and go back to normal production.
And I think we are losing a little bit of bandwidth somewhere. Are you there, Josh?
Oh,
now we're better.
I'm here.
Yeah, we are good.
Okay.
That comment, in fact, takes me back to your earlier book about disruptors, the disruption dilemma. So you're almost suggesting that because there is this information friction which startups can solve, the dilemma seems to be reducing. The public aspect of information becomes more of a private product, a good. And here's an opportunity for entry and creating new normals in some sense. Would you say that's a fair characterization?
I mean, it's really, it's really a greenfield one. It's not like you're going to disrupt existing markets. What there is now this new opportunity that wasn't there before. And, with new opportunities, incumbents and startups can be on a more level playing field.
Very interesting. Overall, Josh, I mean, having written this book now, what's your recommendation of how to implement it in teaching in business schools? How do we blend it in our core courses, in our elective courses? And how do we impact managers and policymakers with our teaching using this book? Any key cases, pointers that you are really excited about? Yeah.
I mean, I haven't got, haven't quite got to that stage yet. I think, that's going to be a very interesting thing. I think, we have a lot of people who teach about management of health and stuff, but it's normally management of health organizations.
Right.
Management of the health of your business is a very interesting thing. I suspect that will come to the fore. I don't know, it butts up against my normal predisposition with regard to teaching, is never to change our teaching in response to a short-term issue. Now, this is a pretty big issue. So, obviously dismissing it as something temporary is probably not the right way to go. I think, that's a great question. I don't have a very good answer. I think there is some stuff that managers all over the shop will need to learn in dealing with this. And I think we're learning a lot as it is. I think, one thing that I find quite interesting just in terms of changes to business as a result of this is the sort of how it has accelerated everything. There's a whole lot of inertia in adopting technology that sort of stems how quickly it gets. And we know this in our own places with online education. Online education has been talked about for 20 years, yet it's hardly had a dent. And then now it's almost 100%. All of a sudden, that doesn't mean we'll stay at 100%,
Right.
but it does mean that everybody who didn't know how to do it now knows how to do it.
Yeah.
And so where that turns out to be better, just on the basis that it is better, that will stay. Where it turns out we've worked out actually it's worse, it'll go away. It's like we decided to say, you know, here's this new technology. Let's take the next 2 years pretending like this is the only thing we have and see how it goes, which is not normally what we do. We normally only adopt things when we really feel we are going to get some benefit, each individual one of us. So it's a massive experiment that's being run. And I think the upshot of that is that we'll have much more adoption at the end of it. And that's not just this, it's things like work from home. I think a whole lot of people are looking at their empty office buildings and looking at the amount of work getting done and saying, why have I got this building?
Exactly.
Why? Maybe people would prefer to work more at home. Now, I don't know the results of that. I mean, you know, there's one thing to work from home when there's a crisis and it's dangerous to go out. It's another thing to work from home as your career. That's a whole other matter. So, but some of that will stick. People will be more tolerant, for instance, of people who have families and stuff like that being acceptable to stay at home when you've got a sick child, because they know, oh, we can do this. We can know what to do in that situation. So I think it really has sort of pushed everybody along. It's given everybody a big shove, which is a very interesting thing that I hope people will study in terms of technology adoption.
And to add to your examples, telemedicine, right? So Dietmar from Germany was talking a couple of podcasts back about how, let's say, the healthcare sector is getting disrupted dramatically, like you said, large experiment. Will was talking about the Duke University story of how suddenly e-visits to their med school have dramatically picked up in a couple of months, and I'm seeing that also here in India.
Why we all have to come with doctors all the time is beyond me. There's so much that doctors can do, and it was only regulations stopping that. And now the regulations were lifted because they had to, and then things worked out, and so somebody can now study that and work out that actually that's what we should have.
Amazing. So you are the Skoll chair in Rotman School. Any last word, Josh, from the book and your body of scholarly work, vast scholarship over the years? Any last word for our listeners? We would have students, PhD scholars, entrepreneurs listening to you, research questions, ideas you've already given to startups. Any last word, Josh, to wrap up this podcast?
You know, I think we're going to have, we have our ups and downs with this crisis. There's no doubt about that. I think there's the day-to-day management, you know, is always going to be difficult. And I think we're going to have, my hope is that we will remember this time, remember what choices were being made and remember what you thought at different times. Because what worries me is when this crisis is over, we're going to be so tired of it, we won't think about it again. But in fact, that's not the message we should have. The message we should have is we don't want to do this again. And I think what we've learned here, and this is the optimistic part, I think we can control almost any pandemic. I mean, I'm sure there's one, you know, that could be terrible, but you know, of any of these sorts were controllable. It was manageable. But it's only that if we set up the capabilities, institutions, cooperation, preparedness to be able to do so. Some countries were able to do that. There's no reason why all countries can't. I've read about certain provincial governments in India doing an excellent job for that reason. It's amazing what, you know, good local regional authorities can do, and that's the message we should take away. Just not forget what it was like at this time, so the pressure can be put on when it's not a crisis to make sure we're prepared, because it's so tempting. The disruption work that I did, it's so tempting to forget about it afterwards.
It's an amazingly thoughtful conclusion. Remember the pain, learn from the pain, and hopefully deal with the pain with much more rational, planned response next time. Thank you so much, Professor George Gans, for joining us from Toronto today. Much appreciate your time, and wish you safe health, and hopefully we'll have you in India soon. Thank you very much.
You too. Thank you, sir. I would look forward to that. That'd be
No,
great. Thank you.